I'm delighted to be speaking with Mark Makhinson. He's Senior Director of Outpatient and Specialty Pharmacy at Mount Sinai Health System. His work spans the full continuum of health system pharmacy with a focus on connected, high-performing pharmacy models. And where care delivery meets technology, from AI-enabled patient engagement to remote monitoring and scalable digital care. Mark, welcome. I'm really glad you're here. Our topic today is the future of outpatient and specialty pharmacy, connected care beyond the hospital. And it's a timely one because more and more of care is happening between visits, well beyond the hospital walls. And Mark, why don't we just dive in now? What do you think?
Thank you, Paul. Thank you.
Great. And your audio might be a little low, or my speakers might be a little low.
Yep. Sorry about that. Can you hear me now?
Much better. Thank you.
All right.
So great, Mark. Thank you again. So as Senior Director of Outpatient and Specialty Pharmacy, how are digital technologies transforming specialty pharmacy services and improving patient outcomes across the care continuum?
Yeah. Well, again, thank you, Paul. Thank you, Stan, for having me today. Very excited to talk about this topic. I'm very passionate about the evolution of digital pharmacy, especially within the specialty pharmacy space. In my role here at Mount Sinai, right, I've overseen several different kind of innovations over the past few years in AI as well as just digital health. And as time goes on, right, as you said, right, and as all the other speakers said, the acceleration just continues to get faster and faster, right? So, I think right now we are in a place of change, just like the other speakers have alluded to. But where we're going is more from operating as a reactive organization to more of anticipating the needs of a patient and their medication needs and their therapy needs specific to the individual patient. Right now, we measure success in the number of prescriptions that we dispense on a daily basis, the number of patient interactions our clinical pharmacists have with our patients. I would like to shift that measure of success to what are the outcomes of the patients, right? And what does their adherence to the right therapy at the right time do to their overall health outcomes, right? I think that's the vision that we're going to be able to drive through digital and AI advancement, right? Taking away the back end, rote tasks that our people do, and changing that to more of a patient focused approach.
Yeah, I think your emphasis on outcomes is key here, right? And that's what we're seeing across the spectrum in health and healthcare is everyone's looking at outcomes. So it's fantastic to hear that. So with that in mind, looking ahead, which emerging innovations such as AI, of course, is a big one now, really taking off as you alluded to, predictive analytics, remote patient monitoring, digital therapeutics. Which of these do you believe will have the greatest impact on the future of outpatient and specialty pharmacy in particular?
Yeah, I want to say all of them, right? I think specialty pharmacy as a kind of industry is relatively new, right? I believe the term was coined about 10, 15 years ago. Specialty pharmacy started with HIV medications, oncology medications, and has expanded from there, right? So we're a relatively new and really fast growing segment of pharmacy as a whole. I think right now we are in a state of three different changes, right? The first being back end automation. I think we are there already. We have been able to automate a lot of the tasks that were really time consuming for our people. So think about benefits investigation, prior authorization, financial assistance, right? Think about taking all of those tasks that somebody needs to do and automating it so that they are focused on reaching out to the patient and engaging the patient to their disease state. Right, so that's number one. I think that's current state. That's table stakes in 2026, 2027. You look a little further than that, right? We need to take this automation and digital enhancement to the patient, right? A patient's daily life is spent online, interacting with your choice of chatbot or LLM. They do it when they're shopping. They do it in their work. That needs to happen in healthcare, and we're starting to see that, right, with the integration of digital tools and AI into platforms like Epic. But it's nascent, and I think that needs to accelerate quickly for healthcare to stay in the same realm as the rest of the marketplace.
Mhm.
So I think that's coming very soon, and I think that will be very widely populated across the next year or two. And then the third piece is anticipation, right? Anticipating um, adverse effects, anticipating patient needs,
Right, right.
anticipating financial burden for a patient, right? With Medicare deductibles changing year to year, right? How can we anticipate a cohort of patients that will need extra assistance coming into a plan renewal year? And how do we target those patients before that time so that they don't have a lapse in care that leads to poor outcomes? So I think that's the goal, in my mind, over the next few years, is to get to a place where we can anticipate a patient's needs in the specialty pharmacy space.
Right, and that really resonates with me and the work we're doing at Blockhaven, is bridging the gap between episodic healthcare, anticipating, what may be happening and trying to intervene earlier. So I think that's fantastic to hear that from you and what you're doing at Mount Sinai. So in particular, in that regard, what strategies have been most effective in strengthening medication safety and adherence for patients, especially with chronic complex or chronic conditions managed through specialty pharmacy?
Yeah, I think I would love to highlight an initiative that we're working on this year that's
Mhm.
kind of pulling together many different sides of the health system, right? Historically, you had your acute care side, that didn't really talk to the ambulatory side, that didn't really talk to the network. We're
Right.
taking that and pulling it all together, right? So a patient that gets admitted into an acute care setting, right? They are getting a medication reconciliation upon admission, and
Okay.
we're starting to think about discharge at the point of admission, right? So
Mhm.
our pharmacy care teams are integrated into the larger care team for the patient. As soon as we have visibility into what the patient's going to need upon discharge, we are doing the back end work, the benefits investigation, the prior authorization if needed, any financial assistance, so that the patient can have medications in hand at the time of discharge. Right, so that's number one. That's going to decrease the length of stay, improve readmission rates. So once they're discharged, then they are in the ambulatory space, right? So we need to ensure that they follow up with a provider, that they're not having any adverse effects on their current medications. So that's where our clinical pharmacists come in to ensure that between their discharge and their first appointment with an ambulatory provider, there is some kind of care in between.
Mhm.
And then once they see the ambulatory provider, then we want those medications filled internally again, so that we can then monitor adherence, ensure that there's no financial toxicity, no barriers to therapy, and keep them within the continuum of care, right? So tying it all together so that the patient has a single source for any clinical questions and any clinical needs, and we can track that, is going to take us to that next level of predictive analytics.
Yeah, very fascinating. And I think we may have time for another question. Stan, I don't know if you're pressed for time, let me know, but I can ask another question to Mark.
Yeah, please. Yeah, another question,
Okay.
minute or two. That'd be great.
Okay, awesome. So Mark, another question I have for you is how can outpatient and specialty pharmacies leverage data, automation, and clinical analytics to optimize workflows while maintaining a personalized patient experience?
Yeah. We have so much data, right?
Mhm.
As a
Yeah.
health system, pharmacy, right? We're integrated into the EHR. We're able to
Right.
pull medical data as well as prescription data. So we have started mining that data to look for trends and to look for ways to better serve our patients and for them to have better outcomes. One thing I would highlight is patient identification, right? So taking the data that we have to identify patients that may be on suboptimal therapies that are not getting the results that they want, right? So think about a patient that's on a cholesterol lowering medication, potentially a statin, potentially a PCSK9,
Okay.
but their LDL is still trending above 190, above
Right.
guidelines, right? How do we identify that patient and have a clinical pharmacist interaction with them, to ensure that number one, that they're adherent, that they
Mhm.
understand how to take the medication, and that they're taking it appropriately, and then secondarily have that pharmacist intervene with a provider and say, we identify this patient, we think that they're a good candidate for a different therapy that's going to drive better outcomes, right? I think utilizing the data that we have internally is so powerful, and we're just scratching the surface on what we can do to improve those outcomes for the patients.
Yeah, fascinating. Yeah, and I really love how you're implementing digital tools across the spectrum of what you're doing in specialty pharmacy. And like you said, it's kind of a new area in a way. So I think it's great. You're kind of at the vanguard of what's happening in digital health. So thank you very much, Mark, for sharing all this. Love what you're doing at Mount Sinai Health System.
Thank you, Paul. It's exciting, and it's just the beginning. I
Yeah.
think that there's going to be so much more exciting innovation very soon.
Uh-huh.
Thank you.
Great. Looking forward to that.